Thank you for watching our module on diet and oral health. Today we will be teaching you about foods that are beneficial and harmful for teeth, proper techniques on brushing and flossing a patient's teeth, and lastly, denture care. This is what the normal anatomy of a mouth should look like. Gingiva, more commonly known as gums, should be pink and intact. Enamel, or the outer surface of teeth, should be intact. With wisdom teeth, there are 32 teeth. Without, there are 28. Be sure to know a patient's dental history, including cavities, fillings, false teeth, dental diseases, oral surgery, etc. All of these can affect how care should be given to a patient's mouth. Many foods are beneficial for oral health, such as carrots, apples, and broccoli. These foods physically scrub the teeth, removing plaque and debris. These foods also stimulate saliva production, which neutralizes tooth-damaging acids, protects tooth enamel, and decreases the risk of developing cavities. Note that some of these fruits, such as apples, can be acidic, so they should be eaten in moderation or switched out with other highly fibrous foods. Drinking water is important after eating. Water acts as a final rinse to remove food debris and wash away sugars and acidic residues, which can contribute to bacterial growth and breakdown of tooth enamel. Eating 3 dairy products a day, such as cheese, yogurt, or milk, is beneficial because these foods are a good source of calcium and phosphate, which strengthens teeth and bones. As you can see, there are many beneficial foods for teeth, but there are also potentially harmful substances. Some beverages that are harmful for teeth include juice, coffee, soda, and sports drinks. These beverages are harmful for teeth because they contain large amounts of sugar and tooth-eroding acids. Alternatives to these carbonated or darkly colored beverages include drinking milk or water. Other ways to minimize the negative effects of these beverages include drinking through a straw or mixing the juice or soda with water to decrease the sugar content. Carbonated and darkly covered beverages should be avoided if possible. Along with the previously mentioned beverages, chewy, sticky, and long-lasting sweets can be harmful to teeth. These types of candy can get stuck in teeth and cause decay. It is best to avoid candy in general. Dried fruits can stick to teeth and have the same effect on teeth as sticky sweets do. It is best to limit consumption of these foods, but if consumed, make sure the patient brushes and flosses teeth to remove any remaining sticky fruit. Starchy foods such as potatoes, white bread, French fries, pasta, chips, and cereal can also cause damage to teeth. These starchy foods can get lodged in between teeth easily. Over time, the starch converts to sugar, which can damage teeth by contributing to dental cavities. Make sure your patients brush and floss their teeth after consuming these starchy foods to ensure that food particles are not stuck in their teeth. Consumption of these foods should be limited, and additional measures to clean teeth should be taken after consumption. Highly acidic substances such as lemons, lime, grapefruit, orange, fruit juice, and coffee can easily erode teeth. After consumption of these highly acidic foods, the mouth should be thoroughly rinsed with water, or the teeth should be brushed to remove damaging acids. Healthy behaviors such as brushing and flossing teeth can prevent dental cavities, tooth erosion, and plaque buildup. Now we will show you how to properly brush a patient's teeth. If your patient needs help brushing their teeth, it is important for you to assist them in brushing their teeth at least twice a day. Suggested times for brushing are in the morning and before bed. After a mealtime is also recommended. First, wash your hands. Make sure you apply enough soap and warm water and thoroughly rinse all surfaces of your hands, including the backs of your hands, between your fingers, and under your fingernails. Dry your hands with a paper towel and turn the water off with the paper towel. Then apply gloves. Now wet the toothbrush with cold water. and apply a small amount of toothpaste on the toothbrush. Hold the toothbrush at a 45-degree angle to the gum line. Make sure to clean both inner and outer surfaces of teeth. Make sure you also clean under the gum line because plaque and tartar can build up here. Use a circular motion along with a back and forth motion to thoroughly clean the teeth. Make sure to get all surfaces of the teeth, including the front, sides, bottom, and back. Lightly brush over the tongue, making sure not to go too far back to initiate a gag reflex. Allow your patient to rinse the mouth out with water after brushing. Thoroughly rinse the toothbrush and then remove your gloves. Now we will show you how to properly floss a patient's teeth. If your patient needs assistance with flossing their teeth, it is important to floss at least once daily. Again, wash your hands thoroughly and reapply gloves. Then remove floss from the floss container and place floss around your middle fingers to floss the upper teeth. Now hold the floss against the tooth while moving the floss up and down on the sides of the teeth. Be sure to get each separate tooth. Now place floss around your index fingers to floss the lower teeth. Repeat the flossing motion on the bottom teeth, making sure to get in between each individual tooth and getting all the way to the back. Allow your patient to thoroughly rinse her mouth out with water after flossing. Be sure to assess if your patient wears dentures or has false teeth. If your patient wears dentures, they require the same amount of care and cleaning as real teeth do. Use lukewarm water when cleaning dentures. Apply a cleansing agent to the brush. Brush the surface of dentures with a horizontal and a back and forth motion to cleanse the biting surfaces. Hold the dentures close to the water during the whole process. Use short strokes from top of denture to biting surfaces to clean the outer surfaces of teeth. Hold the brush vertically and use short strokes to clean the inner surfaces. When placing the dentures back into the mouth, make sure the dentures are moistened and firmly sealed in place. After thoroughly brushing the dentures, rinse the dentures with lukewarm water. Store the dentures in lukewarm water when not being worn. If your patient uses any tobacco products, such as cigarettes, pipes, cigars, or chewing tobacco, then use this as a teaching opportunity. Inform your patient of harmful effects of tobacco use, such as increased gum disease, increased plaque buildup on teeth, increased tooth decay and bone loss, increased incidence of oral cancer, bad breath, and a diminished sense of taste and smell. Neglecting to take care of a patient's teeth is a form of abuse that can cause severe damage to the patient. This damage could lead to difficulty or pain with eating, resulting in potential malnutrition of the patient if they are unable to eat. But remember, by using healthy behaviors such as brushing and flossing, this damage can be prevented. Thank you for taking the time to watch our module about diet and oral health. Now you can apply these proper techniques to ensure good oral health.